Welcome to another Healcerion ultrasound training video. This video will provide some tips for optimizing visualization of the needle with ultrasound. Practice is key. The most important variable for needle visualization is the operator's skill in aligning the ultrasound probe with the needle. It takes considerable real-time scanning practice and experience for successful performance of ultrasound-guided interventions. Practice with phantoms or in a water bath. Here we see reverberation artifact from the hollow shaft of the needle. When inserting the needle in an in-plane approach, the needle is inserted parallel to the ultrasound beam. With the in-plane approach, the needle is seen as an echogenic white line. Here's another image showing the needle in the in-plane approach. When using the out-of-plane approach, the needle is inserted perpendicular to the plane of the ultrasound beam. It can result in poor visualization because the angle of approach is often more parallel to the beam. With the out-of-plane approach, only a short segment of the needle is visualized. Here we see an image with the needle shown in cross-section. Here the arrow is pointing to the needle in the out-of-plane approach. We'll go through some tips to optimize needle visualization. First, larger needles are easier to see. Remember to place the needles perpendicular to the beam rather than parallel, and set your focal zone on your machine to the correct depth. The needle tip's beveled and irregular surface is quite echogenic, so you'll often see the tip even if the shaft is not seen well. It can help to insert the needle with the bevel pointing either towards or away from the transducer to create a little more reflection, enhancing the needle tip. Also, rock or slide the transducer back into the needle path if it deflects out of the image, rather than trying to move the needle. Injecting a small amount of fluid can also enhance the needle tip. And introduce the needle in short in and out motions to cause tissue deflection and make the needle trajectory more discernible. On your ultrasound device, a few settings may help. First, lower the dynamic range, which will produce a little more contrast. You can also try reducing the speckle reduction and set the focal zone to the needle depth. And sometimes putting the multi-focus to the on position will help. Remember, if you've moved out of plane and can't see the needle, to slide or rock the transducer back into position to enable to see the needle properly. With practice, you won't have any difficulty inserting and visualizing the needle under ultrasound guidance.